Hi, I'm Dr. Maneesh Gupta. I'm a senior consultant. I'm going to talk to you today about depression. Depression is a very common illness and it affects 1 out of 4 people across the world. 1 out of 4. That's a very huge proportion of a population that is going to suffer from depression or already has. WHO has found that all across the world depression is the fastest growing illness. Fastest. Even faster than cardiovascular disease. Even faster than stroke, infectious diseases put together. That is why it is important that we understand what depression is. Depression is not merely sadness, and that is a big myth that people have. Depression merely means that the chemicals in your brain are not functioning as well as they should. And these chemicals are those that help you to control your emotions, your behavior, and your relationships. Would you not want these chemicals to be under your control all the time? You would. But there are instances when these chemicals go out of control, and it can lead to hundreds of problems that keep on occurring and bothering us unreasonably. Unreasonable in frequency or unreasonable in intensity. And what could these problems be? Let us see. Darkness in front of the eyes, dizziness, lack of appetite, hearing weird tingling sounds in the ear, feeling weakness despite having a good diet, not having interest in doing anything, things which interested us earlier as well, not wanting to go out with friends, wanting to stay alone, feeling irritated, getting angry, short-temperedness which wasn't us before. There are many other symptoms as well. People come to us with heartache, not heart pain. They feel as if something heavy lies in the chest all the time. They also complain of the heart fluttering, palpitations, dhak 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 karta hai. These are all due to depression and not due to a cardiac disease. People come to us with breathing difficulties. They complain that suddenly I feel as if I am unable to breathe. Suddenly I gasp for breath. Something seems to stop my air from going inside the throat. That is also due to depression. Remember, depression, the illness which we psychiatrists are best trained to treat. Depression can cause loss of appetite. You might feel not hungry, barely hungry, or even if you eat, you might feel that the taste of food is bad. You might want more salt, less salt, more sugar, less sugar, and this would be without having any sugar problems. That is due to depression. Headache. One of the very common symptoms that we see in India in people suffering from depression is headache. Constant, recurring, chronic headaches. People suffer from it for many years before they agree to come and see us. And we find that these headaches are due to depression, not due to stress, not due to lack of sleep, which many people attribute it to. They continue taking painkillers, sleeping tablets, anti-migraine tablets for many years, yet the headaches don't go away. But with proper treatment from a psychiatrist, headaches do go away and you can lead a normal, healthy life. Why is depression important to you? You might feel that because I live a normal, healthy life, no financial stresses, no relationship problems, everything seems fine in my life, I will not have depression. But that again is a myth. None of us are immune from depression. Remember, it is a chemical change inside our brain. It is not due to things happening outside. Whatever you are doing or have done in your life, whether you are rich or poor, whether you have a business, you're self-employed or you're not employed at all, doesn't make a difference. Depression can attack you at any time. The chemicals in the brain do not function as well as they should, and that is what brings about depression. It can be treated. Do not be pessimistic about it. It is today a treatable illness. You come to us, engage in treatment, be positive, look forward to getting back your healthy, happy life. As I say, we can bring back your smile. And how do we do that? Well, there are two main directions of treatment. One is medication. You take medicines which help the brain chemicals to go back to proper functioning, being balanced as they were earlier, helping you to feel happy, helping you to feel strong, helping you to feel that same interest, the enthusiasm and motivation that you had earlier. Medication will gradually help the chemicals to come back to normal. Medication will then support the chemicals to learn behaving normally, functioning normally. And then after an adequate period of time, we will withdraw the medicines if required. The chemicals will continue to function normally and you will remain with a smile. The second mechanism of treatment is psychotherapy. Psychotherapy is not counseling. Psychotherapy is a different mode of treatment. Yes, it is a talking treatment, but it involves you being an active participant as well. You talking to me about what's happening and me helping you to understand what's happening, helping you to find out ways in which you can change things, helping you in finding out ways in which you can intervene, you can reflect, you can challenge your own thoughts and replace them with positive thoughts. Psychotherapy is a very intensive process. It takes time, and not many people today have the patience for that, which is why medications are the preference. And medications are quite advanced. They do not have any major side effects. The longer you take them, the better you feel. And despite taking them for many years, your heart, your kidney, your liver, your lungs, they will not be affected at all. In fact, you will feel better. One of the key questions that I often get asked from family members is how can they contribute to the treatment? And there are very many important steps that you can take. The first step is encourage your family member to seek treatment. That is half the battle won. For a person to be able to accept that yes, there is a problem and yes, I need help from a psychiatrist. Well, you won half the battle then. You come to us, talk about your problems, we help you, diagnose you and provide you the way forward. Second, as a family member, you must always support somebody who is suffering from depression. Do not criticize them. Do not tell them that they are weak. And that is commonly said. Do not tell them to pull themselves together. That is not going to help. A person who has depression knows that he needs to pull himself together, but because he is unable to do so, that is exactly why he suffers from depression, and that is exactly why he needs help. So please bring your family members to us and we will help them bring back the smile.